Hello everyone, how are you all? Welcome to the Medical World by Kanika. This is Kanika Arora, and today I come with a new topic and a most important topic, that is the vital signs. As we all know, whenever we go to any hospital or to the doctor, first our vital signs are being monitored. So today in this video, we will learn about the basics of the vital signs and what is in it. Today we are going to discuss about the vital signs topic. First, we will know what are the vital signs. Vital signs are the indicators of the body, means they tell us what is going inside the body. Second is vital signs are objective data. What the word objective means, that which cannot be told by the patient, but through the vital signs we can note that what is happening in the patient's body. Vital signs are defined as the determinants that provide the information about the basic body condition of the patient. It is something that is not defined by the client or the patient. All of us know that there are four types of vital signs. Whenever we go to the hospital for our checkup, there are only four vital signs which are being measured. First is the temperature through the thermometer, second is the pulse, third is respiration, and fourth is the blood pressure. According to the new research, there are total six type of vital signs. First one is the temperature, second is pulse, third respiration, and fourth we all know is blood pressure. But now two new vital signs has been introduced, that is the pain scale, which indicates the pain of the patient by their facial expressions as well as by the statements which are given by the client. And sixth one is the oxygen saturation. Oxygen saturation is used to measure the oxygen that is present inside the patient's body. So later on we will know about what are the normal ranges of the vital signs. Our next topic is why do we take the vital signs? First one is to detect the changes in the normal body function. We take vital signs to see is there any abnormality in the body function, or is the body working normally right now. So that is why we need to take the vital signs. Second is it tells us about the responses to treatment, about new medication, new activity, and invasive therapy. Whenever the new medication is assigned by the doctor or the prescribed by the doctor, there will be the changes in the body. So to see these changes, the vital signs are being monitored. The next one is it is often the signal of the life-threatening events. It is mostly in the case of the blood pressure, the heart attack. By vital signs, we can get the indicator that the blood pressure is so high and we need to control it at this time. By monitoring the vital signs on time, it can save someone's life. Fourth one is part of assessment process. Whenever you go to any hospital or the community setting, it is very important to take the vital signs. It is often a practice in every hospital, community setting, and long-term care center to take what the vital signs whenever the patients visits, because it will indicate what is going inside your body, and the diagnosis and treatment can be done according to that. Next one is provide the significant info on how the body is functioning at the specific time. It provides the information what is happening inside the body at this point of time. So whenever you feel low, you can take your blood pressure and you will see what is going inside your body. Next is objective data. As I have described earlier, that what is objective data means. The body can tell us what the client cannot. Now we will talk about what are the factors that affect the vital signs, or you can say what may alter your client vital signs. First one is the age. Age really matters. People above 80 or above has the risk of the high blood pressure or the heart attack. That is why the blood pressure is continued monitored twice or thrice a day as recommended by the doctor. Second is the physical activity or the general physical health. In the physical activity, you can say when the person undergo any type of activity such as running, walking, after doing it, the vital signs will show the changes in it. And general physical health means if the person is underweight, the vital signs will be abnormal, or if the person is obese, then it will also show the abnormality. Third factors that affects the vital signs is the emotional state. When the person is in the stress, you have generally noticed that the blood pressure becomes high, and when the person is under stress, the blood pressure is usually low. The fourth factor is the presence of illness or any pain. Illness here indicates the hypertension. If the person is having any illness or any type of disease, there will be changes in the body, and the vital signs will definitely show the change, as it they are the indicators that detect the normal body function. Fifth point is, which is the most important point, is the medication taken. When you take any medication, there will be changes in their body, and the vital signs will show the alteration. Then is the what your client has recently ate or drunk. For example, when if you have taken the hot water or cold water and you monitor the temperature, it will show the alteration. So it really matters, and you have to ask the patient that if he or she has drank or eaten something. So after having this activity of eating and drinking, after 30 minutes the vital signs are being monitored. The second last point is what position your client is resting while you assess the vital signs. The position really affects the reading of the vital signs. When the position is sitting, the reading will be different. When the position of the client is standing, the readings will be different of systolic and diastolic blood pressure. Next are the hormonal levels. The hormonal levels are the changes in the body, and if the hormonal levels go ups and down, there will be definitely changes in the vital signs. Our next main topic is when the vital signs are taken. First is usually when the person is at rest, sitting and lying. Usually the blood pressure is measured by this method. Firstly, by in the lying position, second in the sitting position, and then is the standing position. You can find this practice in every hospital setting or the community setting, and it is mandatory in nature. Second is after certain care measures, that is the ambulation. When the person undergo any surgery, or and if the doctor recommended to do the ambulation, after that the vital signs are taken to check any type of abnormality. Third is before and after the complex procedures or diagnostic test. After and before the diagnostics test, the vital signs are being monitored. Fourth one is whenever the client complains of pain, dizziness, and rapid heart rate. Whenever the client has the subjective data or the statement that he or she is having a pain, or has a rapid heart rate, or do not feel well or dizzy, the vital signs should be immediately taken, because it can be the indicator of the life threatening condition, and a life can be saved. So these things should not be ignored. The fifth one is as stated in the care plan. According to the doctor's orders, the blood pressures are taken twice or thrice a day, and the vital signs are taken according to the care plan. And the last one is upon admission to long-term care facility, hospital, or the clinics. Now we are going to talk about the normal ranges of the vital signs. The range of the vital signs varies from age and position of the person. The normal range of vital signs temperature is 36.5 to 37.5 degrees Celsius. The normal pulse rate is 60 to 100 beats per minute. Remember that the units of pulse is beats per minute and respiration unit is breaths per minute. You can see on the screen. The normal respiration rate is 12 to 16 breaths per minute, and the blood pressure normal range is 120 by 80 mm of Hg. So it's very important to remember this. Our last topic is equipment needed for measuring the vital signs. First, you need the stethoscope, watch, pain scale, pulse oximeter, thermometer, and blood pressure. Thank you for watching this video. If you like this video, please hit like, and if you want any more videos, you can comment your topics in the comment section, so I'll make it for the next time. Thank you.